Mouth cancer, symptoms, risk factors and prevention. Mouth cancer is related to head and neck cancer. Tumors that arise as a result of these cancers are usually either carcinomas, which are found on the fleshy walls of the mouth, adenocarcinomas, which are located in the glandular cells. Mouth cancer is very similar to other cancers we can develop. Likewise, it's very important to understand the symptoms of this cancer. That way, we can also understand how to avoid it. Fortunately, there are methods other than surgery to combat this cancer. That's why a timely diagnosis is necessary, so it's important to identify it early. The main symptoms of mouth cancer. Cancer in the mouth is very easily noticeable. After all, it can cause a sore in the mouth that doesn't heal throughout the course of many weeks. This is the most significant symptom of cancer in the mouth. However, it's not the only one. You should also look out for the appearance of the following. White spots in your mouth, inexplicable bleeding, difficulty chewing or moving your jaw, your voice becoming rougher or changing significantly, losing sensibility or noticeable pain in any area of the mouth, face, or neck, unexplained ear pain. You may also be able to see many different symptoms that can appear for other reasons. Despite this, if you notice 2 or 3 of these symptoms at one time, you should immediately seek out a medical professional. Risk factors for mouth cancer. Together with the other types of cancer, cancer in the mouth develops due to certain circumstances. However, this sickness can appear in people that are not represented under the following categories. Nevertheless, it's still imperative that you keep an eye on your health. If you fall under one of the following categories, pay special attention. Smoking. The exact causes that initiate the growth of cancerous cells in the mouth are unknown. However, it is known that a huge contributing factor to mouth cancer is the unhealthy habit of smoking. Cigarette smoke affects this process greatly. After all, it irritates mucus in the mouth cavity and is directly connected to over 60 of all cases involving mouth cancer. Chewing tobacco causes irritation in the mouth because it involves direct contact with cells in the mouth. In the case of those who smoke, it's a great idea to attempt to quit smoking gradually. There are many different methods and practices that are tried and true to help you stop smoking. Trust us, it will be well to help you avoid this horrible sickness. Drinking alcohol frequently. The excessive consumption of alcohol is another cause that is in large part attributed to this type of cancer. Do you frequently consume alcohol, Do you smoke as well? In this case, you should definitely be very vigilant of your mouth to ensure that no symptoms arise. Unfortunately, you have an increased risk of contracting this sickness. The ideal situation would be to stop this habit as soon as possible. We realize that some types of alcohol can provide health benefits, but you should never forget about moderation. You have a family background of cancer. Those who have a family history of this type of cancer also are more prone to suffering from this sickness. If this is your case, it's strongly recommend that you get a medical checkup once a year. In addition, it's very important that you inform your dentist of your family's background of mouth cancer so that he is aware and attentive to this detail during your normal visits. In many cases, they can be great allies in a preemptive diagnosis. This is because they can check areas that would be difficult or unknown to you. Also, it's a good idea to consult your doctor about this type of cancer and if it is necessary that you participate in a test to make sure everything is alright. Sexually transmitted diseases. The majority of people believe that the only sexually transmitted disease, STD, that is truly problematic is HIV/AIDS. It is true that this sickness is deadly and shouldn't be taken lightly. However, other STDs can also cause grave health problems. One of these sicknesses is the human papillomavirus, HPV. This virus has a great variety of types of the sickness, and not all are serious. The problem is that the types that are more serious in nature can cause the development of cancer in the mouth when transmitted orally. In addition, it's also of utmost importance that you visit a gynecologist regularly to check up on your sexual health through routine tests. Usually, if you receive a pap smear every year, that's enough to cover your bases. Advice for the prevention of this type of cancer. For the purpose of prevention and fighting cancer in the mouth, it's key that you pay attention to the unusual appearance of any of the symptoms that we have covered in this article. Also, look for less known symptoms. When you brush your teeth, be attentive to your mouth and the appearance of blood or any sores that are not healed within approximately 10 to 15 days. Pay attention to persistent throat pain, roughness, or difficulty in movement of the jaw. Maintain a balanced diet. Do not smoke or chew tobacco. Consume alcoholic beverages in moderation.